Hi, Kevin Sartin with Non-Master Physical Therapy with an educational video on labrum tears of the hip. Okay, so what is a labrum? So a labrum is a piece of tissue that wraps around the hip joint or the acetabulum and adds stability to the hip joint. So the hip joint itself, it's a deep joint, so it provides some stability just in that fact, and then the labrum provides some more stability, and then also the muscles surrounding that hip joint provide additional stability as well. So what happens whenever we tear that labrum in the hip is that as our femur is moving back and forth in that hip joint and contacting that tear, it can cause pain. Risk factors that might make someone more prone to having a labral tear are basically other conditions of the hip. So if you have hip osteoarthritis, if you have hip dysplasia, if you have femoral acetabular impingement, or if you're an athlete, all these things can help increase the likelihood that you do have a labral tear. But I got a piece of news for you. This is going to blow your mind, so you might want to sit down for this. Fun fact: 62% of individuals who have hip pain have a labral tear. Okay, I know that was really intense, but that wasn't it. Here's the kicker. 54% of individuals who do not have hip pain, wait for it, have a labral tear. So what's this tell you? It tells you that a labral tear does not necessarily correlate to you having hip pain. So if you've been diagnosed with a labral tear, that doesn't necessarily mean that you're going to have pain. And if you already do have pain, it doesn't necessarily mean that that is what's causing your pain. So sometimes people kind of rush to conclusion like, I have a labral tear, I need to get it fixed. When in actuality, that might not be the thing that's causing your pain. It might be, but it might not be. So all that being said, it's good to kind of take a conservative mindset in regards to a labral tear. Okay, so treatment options. Maybe I should say how we find out we have a labral tear first. Okay, so imaging, if you're having hip pain and you want to kind of rule out if a labral tear is on board, you're going to need to get an MRI. And you want to specifically try to get an MRI with dye or contrast. This is where they'll inject fluid into the joint and it makes a labral tear easier to see. And then let's say, yes, I have a labral tear. What are my treatment options? Okay, well, you can do a few things for short-term relief. So you can take pain medications. They might even give you injections. So whether that be corticosteroid injections or high hyaluronic acid injections, PRP or stem cell injections, all those things can help to reduce pain in the short term. And the PRP injections and stem cells injections are thought to promote healing of that tissue, but it necessarily hasn't been proven in the research. And then the other option would be PT. Okay, so try some physical therapy. So physical therapy is pretty successful in mild to moderate tears of the labrum. About 60 to 80% of folks are going to have a symptom reduction and be able to avoid surgery. And at least you tried it. So try PT first, and then if that does not work, there is a surgical intervention for this, where they'll do a hip arthroscopy, go in, either shave off, the piece of the labrum that's torn, or repair it, and then you'll have physical therapy following that operation. This surgical operation will give relief in about 70 to 85% of folks. So not terrible numbers, but also not quite as good as like a hip replacement typically would, in that 80 to 90% range. So it's not quite as successful. And for that reason, always try the more conservative route first, and then do the surgical intervention, if that fails. And then you've tried all your options and have given yourself the best likelihood for recovery. So hopefully you found this video beneficial and educational. Give us a call or visit us at our website at notpt.com if you have any questions or need any further assistance. Thanks.